Okay, good afternoon, everyone. My name is Bronwyn Starr, and I'm with the New York State Health Foundation. I'd like to thank you for being here at this Practically Speaking series to learn more about the ROC COVID project. First, a few housekeeping items. This webinar is being recorded. A recap with the link to the recording and the slides will be distributed after the presentation. And video and audio are also disabled for attendees. So any questions or comments you have throughout the presentation should be typed into the chat box, and we'll take questions after the short presentation. So now I would like to introduce our speaker, Dr. Michael Hasselberg. He is an associate professor of psychiatry and clinical nursing and the co-director of the University of Rochester Health Lab. Thank you for being here, Michael.
Thanks. Thank you for having me, and welcome everyone. I'm going to share my screen here. All right, so today I would like to talk to everyone about an exciting initiative that we have going on in the Finger Lakes region of New York State called ROC COVID. This has truly been a grassroots effort, but I would like to acknowledge after we got this initiative up and going, we have received funding support from the Mother Cabrini Health Foundation, the New York State Health Foundation, the Greater Rochester Health Foundation to continue this initiative. I'm going to tell a little bit of a story here of kind of how we got to ROC COVID. So ROC COVID actually started off as a University of Rochester specific initiative. When the COVID pandemic really broke out in our region mid-March, the first thing that our health system was most concerned about was that our COVID hotline that we stood up, a telephone hotline that was managed by our emergency room and urgent care clinic, was going to become overwhelmed with patients that are essentially maybe are the worried well, that felt like they had COVID, but really didn't need to actually clog up our call hotline. So our leadership at the medical center reached out to my team, the Health Lab. The Health Lab is our health system's digital health incubator. So we are a team of clinicians, engineers, data scientists, and we build innovative technologies for our system to fill gaps. And so they reached out to us and asked if we could build essentially a screening tool that would help triage patients that were coming to our external website appropriately to our call hotline. And so what we stood up was a chat bot. So a chat bot's essentially a mobile web-based application that as a user you can interact with, and it asks you questions, you respond, it asks you another question. And we stood up our first patient-facing Dr. COVID, actually Dr. Chatbot COVID screener a couple of days after the outbreak happened. And it was quite successful. In the first week, we had about 7,000 patients that came to our website that used it, and our call hotline call volume went down about 50%. The next thing that we were tasked to do was develop a similar application for our employees at the medical center. So our employees that were potentially coming in contact with patients with COVID or other employees. So we spun out the next version of Dr. Chatbot that was a screener that now the employees at our medical center complete every single day before they come back to the medical center. We have since updated that chatbot several times. You know, our clinical experts add symptoms to it, and that chatbot has since rolled out to our affiliate hospitals and has also rolled out to our university campus. So we're not the first that came up with a chatbot application for COVID. There right around the same time we developed our chatbot, there were 2 other academic medical centers that developed their own chatbots. Harvard and Mass General is probably the most well-known. It's a national chatbot. And they have about 1.5 million users using their chatbot. In New York State, however, the penetration of their chatbot is only about 6,000 people a day. And another example is Stanford. Stanford also released a national daily health survey questionnaire. It's a national questionnaire, and to date, there's been about 109,000 uses of this screening tool. So not 109,000 citizens of New York State, but in New York, 109,000 screens have been done. Now, the purposes of these national chatbots were to help predict where COVID outbreaks were happening across the country. And hopefully this data could be used to predict new hotspots and help public health departments make decisions about where to allocate COVID testing or PPE. The thing that we struggled with was these national chatbots, although they were getting good penetration across the country, we felt in our region that this virus is very local and regional. And, there's different social distancing rules in different parts of the country. And it would be really hard to take national data and use that to make prediction models within a local or regional area that were actually useful and to develop kind of guidance around it. So we decided to take a different approach than Harvard and MIT and Stanford, and actually another national chatbot, Carnegie Mellon, partnered with Facebook to do it. We decided that we really needed a chatbot that focused on our region of the state, and we needed to get as much penetration with that chatbot as possible, and that would give us the potential data that would be helpful for our region to make recommendations about resource allocation and social distancing. This graph here just gives you an idea of what's happening in the Finger Lakes region of New York State. We estimate about 1% of our population, and this is Monroe County where the city of Rochester is, and about 14 counties surrounding it have had COVID. And the data that we were relying on to make public health decisions was data that was delayed, that it was based off of PCR COVID tests. There is not endless supply of those tests, and the labs in our region, can only do a couple of thousand tests a day. So to make decisions off of this type of data, it was difficult to do. So in order to be successful, the University of Rochester knew that we could not, this could not be a U of R alone initiative where we would take Dr. Chatbot and start disseminating it across our region. We knew that we needed the whole community's buy-in. So we partnered with our actually competitor health system, Rochester Regional Health, and it's partnered with them to join this initiative. We partnered with our county Department of Health in Monroe County, and then actually the other county departments of health in the region joined on, the city of Rochester, and we also partnered with Common Ground Health, which is kind of our community's neutral data broker. So bringing all of these community partners together, and if we were to launch this public health surveillance chatbot screener, we felt we would have a higher likelihood of being successful. And we also knew that the data could not stay at the U of R. The data needed to go to a neutral data broker, hence Common Ground Health, where all of this data is funneled to. So we launched ROC COVID. So ROC COVID is our region's public health symptom screener. It's a web-based application. So we have a website that's up, www.roccovid.org. On this website, you can sign up to do your daily health screen. You can see some of the data that is coming in regards to participation. If you are an employer in our region that wants to partner and advocate that your customers and employees do this chatbot, there's information around partnership on this website. The screener is essentially an adaptation of our doctor chatbot that we use at the University of Rochester. We developed it in a way that it can be used across devices. You can use it on a smartphone, and that could be an iOS or an Apple iPhone device or an Android device. We've also developed it so it can be used on a computer or a tablet. To give you an example of what this chatbot looks like, as you can see in the phone here, there's a privacy policy that you need to agree to. It then asks you if you would like to receive daily updates or a daily reminder to do your screening, and you can choose to do it via text message or email. Once you sign up, it asks for your zip code. That is the only real kind of specific identifier that we ask for so we can track symptoms. There's a list of COVID symptoms that we update, and if you have symptoms, you have a pull-down menu and you can pick what symptoms you have. We then, if you're willing to share with us, we ask for some demographics, race, ethnicity, age. Once you're done with your screener, you can click for more information, and what pops up is the COVID hotlines for both Rochester Regional Health System and the University of Rochester. We also provide the hotline for the New York State COVID hotline, and we have a link for further resources provided by the CDC. So once you're signed up for our screener, you can choose if you want to receive your daily reminder via email or text message. If it's via email, this is what you will see in your email box. It gives you some updates of how many individuals are participating in the community on a daily basis in the screener. Again, you just click that button and you will go right in to your screener. And then we also have a text message option. So if you provide us your cell phone, a text message will be pushed out to you every day reminding you to do your screener. We did partner with Verizon Wireless. They heard about this initiative and they were really excited, and they support the text messaging platform option for us. We've had a lot of outreach. Again, this has been a full community effort. So our outreach modalities have included digital marketing on Facebook and other digital media online. We've put billboards up across the city and actually across the entire region. So there are billboards up encouraging folks to stop the spread and to participate in ROC COVID. Both health systems have posters on their walls in all their treatment rooms, and we've sent out postcards with QR codes, so folks can just scan the QR code and sign up to participate in this. And then we've had a lot of media, so both print media, television media, and radio media around this initiative. So really the whole community has kind of come together to support and advocate and promote this. So to date, we have about 24,000 participants, which we want to get that number up. And this, again, this is in the community initiative alone, compared to, again, Harvard's national chatbot, where they only have 6,000 participants for the whole state of New York. Again, we have 24,000 doing it in our region. So we are happy about that. We break down our data. We can geo-map our data, so you can actually go over a certain zip code and see how many participants in that zip code are are joining. We have a lot of penetration between the ages of 35 and 75. We're really struggling with the younger age population, and we're struggling with the rural populations. We are having some upticks and improvements in our ethnic and racial diversity. So we are excited about some of our recruitment efforts specifically in those populations. This chatbot initiative allows us to do some real-time symptom tracking. We've actually had a drop in prevalence of symptoms since we've started this in mid-May, and we've gone from 2% of prevalence of people reporting symptoms down to 1%. So it's fairly congruent with what we're seeing with our PCR testing that we're doing in our region. And again, this is kind of real-time data that our public health commissioner can use to help make decisions about resource allocation. The next phase of ROC COVID, as we continue to promote this initiative and grow, I mean, we have not had a large uptick over the last month or so of new enrollees. We have a pretty consistent group of folks that come back and do it every day, but we have not, we're only enrolling maybe 500 or so new individuals every few days. And part of that is I think kind of COVID is not on the top of everyone's mind anymore. But, once we start getting those participation numbers up, we do have some ideas of the second phase of this program. The first thing that we would like to we've been talking about and thinking about doing is randomly selecting users of our chatbot, both asymptomatic and symptomatic users, to actually get COVID testing done, and our county Department of Health would write those orders and actually have a potential mobile testing unit that would go out to these regions to do this testing. This would allow us, that data in combination with our chatbot data would really allow us to do some pretty accurate prediction modeling in our region. It would also help further validate the sensitivity and specificity of the chatbot itself. The other thing that we're doing, and another approach that we've already started on, is starting to link our data to the Rochester RIO, which is our region's health information system, where actually healthcare data from our health systems and community-based organizations go to. So we've started a partnership with the RIO and seeing if we see any relationships between the chatbot data and some of the COVID testing variables that are found in the RIO. Both of these are large efforts, and I want to emphasize, because this is such a large community initiative, just across the 5 partner organizations, we have over 100 people working on this project. We have an oversight work group that meets every morning at 7 a.m. We've got work groups that include a whole team of lawyers. We've got a whole team of clinicians across both health systems in the county. We have a team that just focuses on marketing and communications, a team on outreach. We have a team, a technical team, a data analytic team, and we actually have a team that just looks at user interface and experience. And again, multiple work groups that meet throughout each week. And then we have large kind of work group meetings where we all come together, and it flows up to the oversight committee that meets every morning around large decisions. So this is really, truly a huge initiative with a lot of individuals participating in it. So our next steps is, we're really starting to focus our outreach on those other underrepresented populations. So we're coming up with strategies to engage the younger age groups. We're really, focusing on the rural communities, which has been a really hard lift. And again, we've had some success with some of our strategies to engage, racial and ethnic minority groups. One of the kind of cool things, which is really going to help boost our COVID chatbot numbers for ROC COVID is both the University of Rochester and Rochester Regional Health System. We have our employees and our students do their own screeners every single day. And so, for example, at the University of Rochester, just at the medical center alone, we have 10,000 employees every day that completes Dr. Chatbot before they go to work. Rochester Regional has about 6,000 employees doing their daily screener. And then on our university side, right now we have several thousand faculty and students doing the daily screener, and that's going to go up as students return to work. Both health systems have agreed to share our screening data from our health systems into the community initiative. We've also asked our students and faculty to not do the ROC COVID because we're going to be sharing that data. And we've allowed our employees and students to opt in. So they make the decision whether or not they want their data shared with the community initiative. And as of yesterday at the U of R alone, we've had 10,000 employees and students that have opted in to share their data with the ROC COVID database. So that will get our sample size of 24,000 with our data and Rochester Regional data shared on a daily basis up to about 40,000 folks a day. So we're excited about that. Again, the phase 2 of this project is complicated, especially the COVID testing piece. So we're still working out the operational and clinical logistics to that, but it's something that we're exploring. So that is the ROC COVID initiative that's happening in the Finger Lakes region, and I will take some time to answer any questions that folks may have.
Great. Thank you, Michael. That was a lot to cover in 22 minutes. One of the questions that's come in is asking about, well, first it says congratulations on the effort and the collaboration. But then more specifically, does this system interact with the contact tracing efforts in the counties that are involved with this?
It does not. And we actually made it clear that we had no interest of connecting this to the contact tracing. Part of some of our struggles, and especially we're seeing in our rural communities, is concerns that this chatbot is following them, and data privacy concerns, and that was not an area that we wanted to get involved with. This is truly just more of a kind of get a pulse of what is happening from a public surveillance in a really secured, anonymized way to monitor for hotspots. So no, it's not at all connected to the contact tracing.
Okay, thank you. Another question is about recently, I think there haven't been any new COVID deaths in Monroe County, but in terms of the new cases that are happening, over half of those new cases are among people 30 and younger, which is reflective of what I think is going on around the country. And you talked about the fact that, yes, you're having trouble with outreach to the younger groups, the rural groups. And so can you get into a little bit of some of the strategies that you're using to target those groups? Yeah,
so great question. So specifically for the younger population, so a new work group that just formed over the last week and a half, because we were seeing that gap in our data, is this user experience, user interface work group. And essentially the majority of this work group are individuals at the university and Rochester Regional and our partners that are primarily in their 20s and maybe early 30s, and they're very tech savvy group, and they are working on trying to gamify the chatbot. So, things like positive reinforcements, you've done it 5 days in a row, keep going, you've got the streak going, or, you are one of X number in your community or in your age group, share with your friends, we need to get those numbers up. So they are really focused in on, again, how do we gamify this? We're also we're working with our communications and marketing team to be more specific with our digital marketing outreach. So, we can change our digital marketing campaign to really hone in and focus in on certain demographics through Facebook and Twitter and other social media platforms. So that's, been a big lift and what we're focusing for the younger population. For now, the rural counties, part of the funding that we've received from both the New York State Health Foundation and the other foundations is actually going to go to Common Ground Health to hire outreach coordinators who are in those communities, that know those communities and can kind of, hit the ground and promote it, boots on the ground, essentially, to get the word out and share it. So that is kind of some of our strategies in more of our rural counties. And then for our ethnic and minority populations, some of the strategies we've done is we've kind of partnered with some of the influencers in those communities. So we've partnered with some of the church communities and some of the specific employers in those communities and getting champions to promote it. And that is actually really, we've started to see over the last several weeks, those efforts really working as we're having a large uptick in those populations. We do have also a Spanish version of the chatbot and website. So, we have that to support our Spanish-speaking populations, and we've had preliminary discussions around an ASL version as we have a very large deaf community in the Rochester region.
Okay, thank you. Another question is about, you just discussed earlier the difference between this tool and some of the larger national ones that may have gotten some more press and been a little flashier, but because of the uniqueness of this tool, have other regions of New York State reached out to you about this? Or are there other efforts around the state that are like this going on?
Oh yeah, well, I can't speak to other efforts in the state that are going on, but we've actually had a lot of publicity around it because we're thinking much different than the rest of the country. Where the rest of the country is trying to take this large approach and then apply that data down to the local level, which we don't think will work. We're taking, again, that local approach and actually arguing that you could probably extrapolate insights that we gain at the national level and apply this to other similar communities. So we've had state governments and across the country reach out to us, other regions of the state reach out to us asking us how to do this. We've actually had multiple employers wanting this chatbot functionality for return to work, and we could not meet that demand. So what we actually did was, for our employee chatbot, that doctor chatbot, we open sourced our code, which means we just gave it away and said, if you're, we're not going to charge you, we're going to give it away for free. And that has actually gained us some really kind of cool national publicity. An organization called the X Prize, which is based out of Los Angeles, big. I mean, those like the who's of innovators. It started in the SpaceX or the space exploration field in the 90s, and they have these kind of world-focused global initiatives. They reached out to us because they heard that we open sourced our code and said, that is really cool. You could have sold this and probably, made money off of this. And instead of trying to monetize or commercialize this, you're just giving it away. And that aligns with what we're trying to do. And they've invited us to join the X Prize Pandemic Alliance around trying to do this across the world. And we've had our first meeting, and the first meeting was all again focused on how do we take these national data sets and tie them all together. And I said, well, in New York, in Rochester, New York, we're taking a whole opposite approach, and this is what we're doing. And we flipped their whole thought process. So now they're like, yeah, this is how we need to be doing it. So we may see the next X Prize being around replicating ROC COVID across the country.
Okay, thank you. I feel like we're at time. I feel like that's a really good way to sign off on this webinar. I want to thank you for being here. I want to thank everyone who's attending. we'll maybe be able to check back with you in a few more months and see how things are going.
Yeah, absolutely.
This is part one of a few. I want to just let the audience know, remind you guys to follow us on Twitter if you can, or to go to our website to sign up for newsletters about upcoming webinars and other resources. And just to let you know, our next webinar series will be on July 21st, and we're going to be discussing the impact of COVID-19 on survivors of domestic violence. So we hope you will tune in for that as well. Thank you everyone for joining us. Have a great rest of your day.